start with just that. Then we're going to take it into core. So you're lifting up that knee, you're pressing, you're breathing out, you're pulling the belly in.
Okay, Christine, could you, or Sonia, if you could start recording, please.
Recording in progress.
Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe-Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe-Muskoka. So the last time I reported was December the 22nd, and since that time, we have surpassed 20,000 cases in total since the beginning of the pandemic. So in fact, our tally right now is 21,487 cases. This is up 3,568 cases since December 22nd, and 2,306 cases for the week starting December the 26th. And today, in the past 24 hours, we've had 715 cases. So we are at very high rates of transmission right now, much higher than we've ever seen in the pandemic to date, including the daily count being the highest that we've ever had. We've increased by 93% from December the 19th to the 25th compared to the preceding week. So for the week of the 19th to the 25th, we had 1,644 cases, compared with the week before at 853 cases. And our incidence of cases in the past week was 272 cases per 100,000 population per week. So that too is higher than we've ever had. We've had a greater increase in Simcoe County compared with Muskoka. So Simcoe County had a 97% increase in cases compared to the previous week, compared with Muskoka at a 51% increase in cases compared with the previous week. The province had an even larger increase in their case count, up by 171% compared with the previous week, and having an incidence of 348 cases per 100,000 population, up from 129 cases per 100,000 population per week. So we find ourselves now below the provincial incidence of cases on a per capita basis. And this is the first time that we've been below the provincial rate since December the 17th. Although through the remainder of the pandemic, most of the pandemic, in fact, we've been well below the provincial incidence of cases. Currently, we have 4,246 active cases that are either isolating or in hospital. At this point in time, there are 27 individuals in Simcoe-Muskoka or from Simcoe-Muskoka that are hospitalized, and 8 of them are in the intensive care unit. So the remainder would be isolating at home or in a facility that they live in. We've found that the majority of our cases are actually fully vaccinated with 2 or more doses of vaccine. So 73% of recent cases since December 19th or 25th in that week interval were fully vaccinated. We've found that on a per capita basis during that period of time, the incidence of infection among those fully vaccinated essentially is the same as for those who are not fully vaccinated, those who are unvaccinated. So essentially the same incidence. For those who are fully vaccinated, 265 cases per 100,000 population per week, compared with those who are unvaccinated at 278 cases per 100,000 population per week. And so this does speak to the fact that Omicron as a variant does not show a high vaccine efficacy or effectiveness for 2 doses of vaccine, that you really need a 3rd dose booster to get protection against transmission. There's evidence that 2 doses provides protection against hospital admission, against being a severe case, but not very high with regards to the prevention of transmission. So as I indicated before, at this point in time, 27 individuals from Simcoe Muskoka are hospitalized with COVID-19. And this is actually down from 31 when I last reported. And 8 of those are in the intensive care unit, which is unchanged from when I last reported. For those who are admitted, 52% were unvaccinated. And for those who are of the 8 who are in the intensive care unit, 2 of them were vaccinated with 2 doses and 1 vaccinated with 3 doses. We actually have incomplete information with regards to the variant subtype for those that are hospitalized. So most of the cases we don't have the subtype, but we do know that 6 of them were actually Delta, and 1 of them had the marker for being Omicron, the S gene target failure. So the others we don't know. It may be that, in fact, a good number of those that are hospitalized are actually from the 4th wave, the Delta wave, and that the impact of Omicron on hospitalizations is yet to be manifest, yet to be felt. We have had 2 additional deaths since I last reported, and I would like to express my condolences to the family members for your loss. So to date, we've had 288 deaths. So of the 2 that occurred in the past just over a week since I last reported, 1 was a man more than 80 years of age from Simcoe County. The other was a woman between the ages of 65 and 79 from Simcoe County. Neither had been vaccinated. When we look at the pattern of transmission, we do continue to see that children represent a high number of cases of our outbreaks. So this is, I think, reflective of the outbreaks that had been happening in schools up until the school break for the holidays, and we still consider them to be in outbreak until we get out 10 or more days beyond the last case. And so a third of our outbreaks involve schools, elementary schools, and also some are secondary schools. So 8 of them are elementary schools, and 6 are secondary schools. We also have other settings that involve vulnerable populations, such as congregate settings or settings that provide care and shelter and services for those that are medically compromised. So we have a shelter in outbreak, we have 9 group homes, 2 other congregate settings, a hospital, the South Simcoe Memorial Hospital, sorry, I beg your pardon, South Muskoka Memorial Hospital, and that's actually limited to their custodial department, not affecting parts of the hospital that are providing care in keeping with their own press release on this matter. We have 7 long-term care facilities, and they are Trillium Manor, Bob Rumpelt Home for the Deaf, IOOF, Bay Haven Care, Simcoe Shores, Mill Creek Care Center, and Leacock Care Center. And we have 1 retirement home, Berryview Retirement Home, that is also in outbreak. We have 4 childcare centers in outbreak, and with regards to the variant of concern, regarding those outbreaks. One was confirmed by whole genome sequencing to be Omicron. 10 others are probable Omicron with the S gene target failure marker, and 7 have been confirmed as being Delta variant outbreaks. So we're still experiencing the impact of Delta here with regards to some of our outbreaks and some of our hospitalizations. We're still, I would say, in a transition phase. So at this point in time, 94% of the most recent Omicron cases have actually, or I beg your pardon, 94% of the most recent COVID-19 cases in Simcoe Muskoka have been Omicron cases, either confirmed or likely with the marker detected. In comparison to other health units, for a long time, we, in the fall, early winter season, with the 4th wave, the Delta wave, we're riding at the highest incidence of cases compared with other health units in the Greater Toronto Area. We are now at the lowest incidence of cases compared with those other health units. So although we've had a very large increase in our cases, those other health units have had that much greater of an increase in their cases, as has the province as a whole. So at this point in time, Halton region in the Greater Toronto Area has the highest incidence at 483 cases per 100,000 population per week. The top 5 health units for incidence across the province are Halton region, Kingston, the Kingston area, so the Kingston, Frontenac, Lennox, and Abington Health Unit, Toronto, Hamilton, and Ottawa. As I'd indicated, Omicron is now the dominant variant for new cases. As I'd also indicated that we've still had the influence of Delta with regards to some of our outbreaks and hospitalized cases. But for new cases, over 90% of our cases are due to Omicron. When we look at the profile of those cases, we find that they tend to be younger. So the majority of them are under the age of 60. They are the majority of the outbreaks that have been happening in schools, in our congregate settings, more of those cases are found to be happening in Simcoe County as opposed to the District of Muskoka, although there have been many cases in Muskoka as well. And that the majority of them are actually happening among people who have had 2 or more doses of vaccination, as I'd already indicated. Okay. Our hospitals, although they don't have a high number of COVID cases as yet, are challenged. In my communication with the leadership of our hospitals, I learned that they are seeing a big draw on their emergency departments, a reduced ability to transfer patients back to long-term care facilities because of outbreaks, and that many of their staff have been off ill, so challenged with human resources. Also, hospital occupancy itself can be a challenge. So 3 of our hospitals are at full capacity. So this is not because of COVID cases per se, but because of other things that are happening. And so far, 3 of our hospitals also are at 100% capacity for the intensive care unit. We continue to move forward with immunization, and in particular move forward with booster doses. So if we look at overall coverage for first and second dose, we remain at 88% of our population 12 and above having received 1 dose, and 85% having received 2 doses. When we look at the provision of booster doses for those who are eligible. So that's the 18 plus population. Those are 18 years of age and older. 29% of that population has received a booster dose in Simcoe Muskoka. And if we look at those that are higher risk, older population, those over 70 years of age or 70 and above, 64% have received their booster dose. So that's certainly an important indicator because we know that 2 doses is not going to be sufficiently protected to prevent people from becoming cases. It's certainly helpful for reducing severity and likelihood of being admitted to hospital, but not enough to protect against becoming a case. 3rd dose is really required to give a reasonable level of protection, estimated between 60 and 80% protection. But all people, regardless, need to abide by the public health measures beyond immunization. So get all the immunization that you're eligible for when you can, noting that it can be hard to book in the near future. And otherwise abide by greatly reducing your social circle, physical distancing of 2 meters, and mask use when in indoor company with other people, particularly public settings outside of your household, self-monitoring and isolation if you develop symptoms or are in contact with a case. We are going to be challenged, generally speaking, to be able to get testing at this time. And most cases actually won't be followed up directly by public health. You'll have to monitor yourself and manage these things yourself for the most part. I will be speaking a little bit later about Dr. Kieran Moore's announcement, the Chief Medical Officer of Health yesterday, about the prioritization of testing and follow-up. But for the most part, for most people, it would be self-identification as a possible case or contact and self-isolation. And seeking medical assistance if, in fact, you develop severe symptoms. Okay, so with regards to the vaccination of children 5 to 11 years of age, that too is a priority for us, and we have provided first dose immunization in that population for 40% of that population, some 17,203 individuals having received that vaccination. And we look forward to providing second doses 8 weeks after they've received their first dose. So we do note when we look at the pattern of transmission under districts, certain things. We note that there are probably many more cases than the numbers that have been detected by testing, because the numbers are exceeding the capacity of our system collectively to provide testing. And so we also look at the percent positivity as an indicator. So this is actually just the percent of our tests that come back positive, and it's an indication both of the amount of transmission happening, but also the sufficiency of testing, and anything above 3% is of concern. And so in the past week, we've had a significant elevation of our percent positivity as well. With locally our percent positivity being 14.5%, and the provinces is well above 20%. And this is up from 6.8% locally the last time I reported. But when we look geographically in our area, we're finding that the percent positivity is highest in our South Simcoe area at 17.5%. And also our case count incidence is highest among young adults, those 18 to 35 years of age. We have an incidence of 505 cases per 100,000 population per week, twice as high as children. So through the Delta wave that we had, wave 4, children under the age of 12 who could not be vaccinated had the highest incidence, but that is now no longer the case. It's young adults that are predominating. And in part, this would be because we know that 2-dose vaccination is not really providing them protection from becoming cases. So our monitoring dashboard is red, and this is because of viral spread being very high, laboratory testing, and yellow status still getting sufficient turnaround time in testing. People's access to testing is certainly reduced, and the percent positivity has gone up quite high. The health system capacity so far is in yellow, with yellow status for acute bed occupancy and green for ICU bed occupancy. And the public health system capacity is in red because of our reduced ability to follow up cases. If I turn to our key media messages, they're as follows. Yesterday, the Chief Medical Officer of Health, Dr. Kieran Moore, spoke to a number of really key things that I thought I would repeat. First off, there's been a fundamental change in the approach to testing. So I've indicated in my press conferences over the last probably 3 weeks that we were anticipating that the case count would exceed the ability of the system to be able to provide tests for everybody who is a potential case, and that people would have an increasingly more difficult time accessing testing. And if you can't access testing and you have symptoms or are in contact with somebody who might be a case, that you need to self-isolate and advise your contacts to do the same. And so now provincially, there's been formally a shift to prioritize testing, PCR testing, such as at assessment centers, for those who are most vulnerable to becoming a severe case, so those with pre-existing medical conditions, those that are being assessed in the emergency department or elsewhere in the acute care system, with regards to their severity as a potential case, and also those who reside in or work in high-risk settings. And basically this would be hospitals, long-term care, and retirement homes, and other congregate living spaces, that testing would be prioritized to those populations. We also note the requirement for isolation, that, as it indicated, people who suspect they may be a case or contact of a case need to put themselves into isolation. And so the province has put out now guidelines for standards for that, and indeed reiterates that most people aren't going to be able to be tested and need to put themselves, identify themselves as a case, potential case, or a high-risk contact of a potential case, and put themselves in isolation. And the duration of isolation will depend on some detailed assessment of the situation, but the default would be 10 days. So that would be for both cases and contacts. And the exceptions to that would be individuals who are fully immunized, that they would be able to go down to a 5-day period, or children under the age of 12 would be able to go down to a 5-day period, provided at the end of that 5 days they either have no symptoms if they're a contact of a case, or if they have symptoms, that their symptoms are improving and need to be sufficiently resolved for them to come out of isolation as well. And that their household contacts would also need to be in isolation for the same duration of time. There are also some differences noted for people who are working in high-risk settings, so the healthcare settings, healthcare workers in healthcare settings, in particular hospitals, long-term care facilities, retirement homes, elder care homes, that they would need to be isolating for 10 days as a case, or a contact, and there would be the potential for them to come out of isolation if they are able to be tested with a rapid antigen test, actually 2 tests 24 hours apart on day 6 and day 7, in order to be able to come out early of that isolation. So it's a fairly detailed set of requirements. And there is a website that you can visit that's linked on our website, a provincial website, which is ontario.ca exposed, that runs you through an algorithm to help you identify exactly how to manage your own situation if you are a possible case or contact of a possible case. With regards to return to school, the province's intention is that in-person learning would begin next Wednesday, January the 5th. This provides an additional 2 days for schools to make preparations and changes required to reduce the risk of transmission in those settings. Part of that would be the requirement for active assessment for symptoms, active screening of all that are entering the premises as they enter. So that and other measures are coming into place in order to reduce risk. The province is also putting a cap on the number of attendants you can go to large sporting or theater venues, so no more than 1,000 people, or 50% occupancy, whichever is less. With regards to vaccination, the province is requiring a 4th dose of vaccination be provided to the residents of long-term care facilities, retirement homes, elder care, lodges, and other congregate settings that provide care for older adults. And so as a health unit, we are proceeding with supporting those facilities as they provide that additional vaccination coverage. And this is in keeping with evidence that finds there can be waning immunity in that population after 3 months of a 3rd dose, and so 4th dose is needed to help protect them. And we are seeing some outbreaks in some of these settings at this time, so it's certainly important to be able to do that. The province has also indicated a requirement for those who work or enter on a regular basis, staff, students, volunteers, caregivers, and support workers to have a booster dose, a 3rd dose, in order to be able to continue to work in that environment. And they have a timeline by which that is to be achieved. We are finding that the call volume to us exceeds our capacity to be able to respond in a timely way to all calls. And we do want to direct people to look at our website first to obtain information to help address that and help you meet your needs, given our limited capacity to be able to answer all calls. We also note that there's been a lot of change that was announced yesterday. We are moving as quickly as we can to update our website. The really key information should be up on our website by the end of the day today, and then follow up more detailed resources that we develop. Fact sheets and such will take us into next week to complete. We also want to offer enhanced access to immunization for Simcoe Muskoka residents receiving their booster dose who are in high priority, high risk populations. So we are finding that it can be challenging for them to be able to get access to vaccination. Otherwise, there's a high uptake of vaccination for the whole population, 18 plus, and also for people from out of district. And so we are going to be setting up an additional set of clinics that can be booked for people in those high priority groups who live in Simcoe Muskoka on our website, separate from the province's booking system. So on our website, you'll find the means to make such bookings. And the following people would be eligible. So you have to be from Simcoe Muskoka and have to come with proof of where you live if you get a booking for such. And otherwise, we'd be providing vaccination for those who are 50 years of age or more, 84 days or more from their 2nd dose. Healthcare workers and designated essential caregivers in congregate settings such as long-term care homes, retirement homes, the staff as such, designated caregivers for such who are 16 years of age and older, individuals who had received their 1st and 2nd dose as AstraZeneca, or those who had received 1 dose of Janssen vaccine. And once again, this is 84 days after their final dose with that series. And First Nation, Inuit, and Métis adults and their non-Indigenous household members who are 16 years of age and above. So as I'd indicated, people would be able to book on our website if you meet those criteria, and we'll be asking for proof of your eligibility with regards to where you live and the groups that you would be in, the priority groups. Otherwise, we ask for your patience in all of this. I know this is very stressful for people to be able to get vaccination, especially with there's so much transmission happening in our communities right now. So just to give you a sense as to when and such, we have 2 clinics that are going to be taking place on January the 2nd, and we have another clinic set on January the 9th. So people should look for that and be looking going forward into the future about us making opportunities like that available. Also want people to know that going forward, we will only be able to provide Moderna vaccine for those who are 30 or more years of age. And this is because there is a limited supply of Pfizer vaccine at this time into the foreseeable future. And for those who are under 30 years of age, 18 to 29, their booster dose would have to be Pfizer vaccine based on provincial direction, Pfizer being a lower risk for developing the rare side effect of myocarditis or pericarditis, so inflammation of the heart that can occur in young adults and occurs more frequently with Moderna vaccine than Pfizer. So we reserve a Pfizer vaccine that we have for those that are 18 to 29 for booster shots, and the remaining population, 30 and above, we'd be providing Moderna vaccine. Moderna vaccine is an excellent vaccine. It provides a robust immune response. By some research, a more robust immune response than Pfizer. So advantageous for the older population in particular. And certainly, I continue to advise that people access, when you can, vaccines that you're eligible for, whether it's a booster dose or whether it's a first or second dose for those who haven't accessed vaccine as yet. So I would like to wish people a happy new year and indicate that people really need to be careful at this time about the risk of transmission. We have absolutely historic levels of transmission happening across the province and here in Simcoe Muskoka at this time, and going up. And so very important people take the risk very seriously. I've indicated that vaccination is a key thing. You can't rely on 2 doses to be sufficiently protective against transmission, though it does provide some protection against hospital admission. Need a 3rd dose, but beyond that, greatly reduce your social circle. The safest thing of all at this time would be stick to your household and otherwise congregate with people remotely, or if you're going to do it in person, outdoors, and even then maintaining physical distance of 2 meters or mask use if you find that you're not. So indoors is much more hazardous for people out of your household. Need to be aware of that. Better if they were vaccinated with 2 doses or preferably even 3 doses, but you still need to be cautious because of the potential for transmission. People need to continue to monitor themselves as well. If you develop any symptoms, you need to isolate and identify this to others you've been in contact with for them to isolate, in keeping with the isolation recommendations that I've already cited that were released yesterday from the Office of the Chief Medical Officer of Health. So I have the following media questions. Can you speak to the importance of exercise and nutrition when it comes to lowering risks associated with COVID-19? Well, I would say that it's always very important for people to do what you can to maintain good health in general, and that certainly includes physical activity and a balanced, nutritious diet. And at this time with COVID-19, when you're being physically active, the safest way by far would be outdoors. And if you're not doing it outdoors, then in your home with your household only. So people can access remote physical education's instruction, and other means of having peer support that don't put you at risk, that are done remotely. So very important that you take good care of yourself in that way, and do what you can to reduce your stress, and do what you can to maintain social contact with people in a safe way. So remotely or outdoors, and if in close contact outdoors, but in close contact with a mask, and a good quality, well-fitting mask. Those are important things to do for your health. This pandemic has been very long, and it does continue. And despite all, you do need to do what you can to take care of your health. One factor that has been associated with increased risk of a poor outcome for COVID-19 is smoking. And so discontinuing smoking would be one thing that would be very helpful for reducing risk against COVID-19. But by itself would not be sufficient. It would still need to do all the other practices that I've cited. Why is SMDHU not accepting positive rapid test reports like other health units? So I'm aware that some health units are seeking to augment their surveillance systems by inviting people to submit positive results from their own testing that they've done with rapid antigen testing. So it's a way I would cite of augmenting the surveillance systems that they have. In my mind, we are exceedingly overstretched as a health unit without also taking on an attempt to accept such data. So we're not going to be doing that at this time. We do know that transmission is very high, and even with a shift in prioritizing testing, we're still going to see high counts come in. And another indicator that we will monitor is the percent positivity. So even if you have increasingly inadequate coverage of testing, you will get an indication of that with an elevated percent positivity or an increasing percent positivity. So that's an important indicator. The number of outbreaks is an important indicator. Although we are going to be focusing our response to outbreaks in congregate settings, we've had to focus for several weeks now our response to outbreaks, and I'm able to confirm many of them. So we'd acknowledge that too will become a less reliable indicator. Hospitalizations is certainly an important indicator, and by the science table's projections, we would anticipate increase in ICU admissions in the weeks to come. Fortunately, we've not yet seen that here, but that will be really a critical indicator of transmission. So for now, we're going to be sticking with those other indicators, those other markers of transmission, other ways of doing surveillance. We've received a few calls from people who have tested positive for COVID-19 who have yet to hear back from the health unit about their tests several days after getting tested. And those who have received positive tests are still awaiting next steps and contact tracing. Is this still a priority? And I say that I'm afraid for several weeks we've been unable to get to a good number of those who've tested positive. And now going forward with the new direction from the province, we will not be able to get to most cases. We'd be focusing on those that would fall into priority populations, those that are working in the congregate settings, those that are part of outbreaks in congregate settings, because we don't have the capacity to be able to get to others. And people would need to be aware of that. That's part of our messaging up until now, more recently, but certainly going forward. People would need to know that they're not going to get a call, or they probably won't get contact from us and that they need to self-identify with or without a test. If they have symptoms or if they have been in contact with somebody who might be a case, they need to self-identify and to determine how long they need to be in isolation, using the province's tool that's linked on our website to help them determine that. And certainly if they develop severe symptoms, to seek health care through their healthcare provider, through telehealth, or through the emergency department. With the province's announcement yesterday that they would be changing the guidelines for testing and reporting of COVID cases, I'm wondering if that will impact the local reporting of COVID-19 cases in schools. Will COVID-19 cases in schools still be reported the same way? So we will not be following up with cases in schools on a routine basis. We will remain accessible to schools for consultation as needed with regards to absenteeism, but cases occurring in schools will need to follow the provincial guidance that I've cited already about isolation and exclusion from attending school while they recover. And some of them would be able to identify with the testing that they provided via the school's rapid antigen testing or PCR testing, and others may not be able to have access to such testing, so they need to self-identify with symptoms. And so we won't have detailed data about school cases and school outbreaks as part of the response going forward. Do you think that schools are safe for students to return next week? So what I would say is transmission is happening throughout our communities at this time, including household transmission and in other settings where people get together, work, or recreational centers. And we have indeed had school outbreaks as well. And by definition, that means a school in which we feel there's evidence that transmission has taken place. So schools have seen some transmission. We are challenged in being able to prevent transmission in the community, including in school settings. I would say that schools are probably safer than most other settings where children might end up being because of all the measures that have been put in place. But I wouldn't be able to guarantee that they would be completely free of transmission, because in fact, we've seen transmission happening in schools. So at this point, I'd be happy to take questions.
Thank you so much for your update this afternoon, Dr. Gardner. We will now take some questions from the media. And as always, we do ask that those participating limit themselves to one question and one follow-up in consideration of time. Can we start with Erica Engel from Collingwood Today? Do you have a question this afternoon?
Hi, yes, thank you. Dr. Gardner, my question is regarding hospitalizations. There's information coming out at a provincial side indicating that there were some incidental hospitalizations included as COVID hospitalizations. Do you have a grasp on that locally, whether the hospitalizations you report are because of COVID or it's just people going to hospital and then incidentally testing positive?
Yeah, thank you for that question. And I did see Dr. Moore speak to that question yesterday, and specifically cited in the Kingston area, they were finding a substantial number of those admitted to a hospital and were found to have COVID-19, even if they were there for another reason. And therefore, they needed to be able to sort out the main reason, the degree to which their infection contributed to their hospitalization. So I don't have data on that locally, but given what the Chief MOH cited, that is important. That is something that we will look into. We don't have an elevation at this time beyond the previous few weeks with regards to hospitalization in Simcoe Muskoka from COVID-19.
Thank you. What will be the detriment of not knowing how many cases there really are in the region for you?
We always know that surveillance doesn't pick up everything, that for every case that you know of, there's an unknown number of cases that are in the community that didn't have symptoms or they didn't come forward to get tested. So we've always known that it's not been perfect. And I would say that as you get in a situation where your capacity is exceeded by what's happening, we just have to take that into account, that any rise that we see, or if we see a plateau for a while, we know that that number by itself is not reliable, that we have to be looking at other indicators of severity as well, such as hospitalization, ICU admission, the percent positivity. It is one indicator. We'd have to be looking at it along with others.
Thank you. And just really quickly, did you find out how many deaths there were in vaccinated individuals?
We gave you that information 2 weeks ago, a comprehensive review. I haven't looked since.
Can we go with Matthew Riesler from Moose FM? Do you have a question?
Yes, thank you so much. You kind of detailed it earlier, but for lack of a better word, I would say that what you suggested for people to do who aren't able to get tested, or it's kind of like the basics in terms of self-isolation, washing your hands, limiting your social contacts, all that. Is there any more that you would suggest for people to do, maybe taking an extra step in terms of making sure they're protecting themselves and others, aside from doing the basics?
I'm afraid there's really not more that people can do, but if they in fact put in place all of those measures, they will maximize their level of protection. And this is a very transmissible virus, so it's going to be challenging for all of us regardless. But people will do much better if they put in place all of those layers of protection. So vaccination, got to get to your third dose. 2 doses helps reduce the severity, but not transmission. I really think people need to greatly reduce their social contact. If you could take it down to household only, that's going to be the safest. And even then, it's possible that somebody in your household could bring it into your household, depending on what they're doing. So you need a good discussion in your home about your safety plan together. To reduce the likelihood that it gets brought into the home, and connect with people remotely, connect with them outdoors. It's much safer if you're outdoors but can't maintain the 2 meters, use a mask. Certainly you've got to be careful about your decisions about going out and into indoor public spaces. How essential is it for you to be doing that? And when you do it, safest if it's somebody in the household who's had 3 doses of vaccine. Certainly anybody who's going out to such settings needs to wear a high quality mask, 3-ply cloth at a minimum, but Public Health Ontario's recommendations now really include the potential to use a medical mask or even a non-fit tested N95 mask or equivalent when going out to such settings. Physically distancing, as I said, work remotely if you can, talk with your employer about that now to protect the work environment and protect everybody in it. So, I think it now is the time, and before now even, to really take a close look at your risks and the ways in which you can get exposed, or the ways in which it can be brought into the household, and what you can do to reduce that risk.
And we're seeing record high positive test percentages, as you detailed earlier, not just locally, but provincially as well, of course. What do you foresee happening in the early part of next year, January, February, and maybe a little bit into March? Do you see this continuing, or do you see maybe this starting to taper off a little bit? And with that in mind, what advice would you have for people in Simcoe Muskoka as we head into a new year?
Well, I've seen some people that have prognosticated, look to the future. I understand that Dr. Moore had done some reflection on this today, even to the media. I don't know if I have a clear vision myself as to exactly what will happen. I think it'd be, entirely predictable that this will go up substantially before it comes down. And I'm not sure over what duration of time that will take place. I do know that in South Africa, it shot up to very high levels and is now rapidly coming down as well. We shall see if we have that experience here or if we have a different pattern. It's really, really hard to know for sure. So I really would not trust my own ability to make a prediction of that nature.
Okay, thank you, Dr. Gardner.
You're welcome.
Mary Beth Hartle from Muskoka Region, do you have a question today?
I do, thank you. Actually, I have a clarification, a question, and a comment, if that's okay. Clarification, when we say it changes to 10 to 5 days, depending on whether you're fully immunized, is that with 2 doses or 2 and a booster?
2 doses. Though I would say 3 doses would be better. And when it comes to, the province's guidelines now, but case and contacts and isolation and testing, they do cite that for healthcare workers that might be returning early as contacts with testing and PPE use and physical distancing under conditions in which there's no other option, that they would prioritize those that had had a 3rd dose over those that had had 2 doses.
Okay. And when we're looking at the reporting, because you guys have done an excellent job at the reporting all this time, and if people are self-assessing and self-isolating, obviously the reporting is just going to be a mess. So what will we be getting on the website now?
So we're going to end up with less. And right now, my epidemiology team is preparing messaging for the media for next week as to exactly what that will look like. So next week, I'll be able to provide some detail as to how much less you're going to get. But as we get into January, one of the things you're going to see a drop off in is reporting by a lower tier municipality basis because of the unreliability of the reporting, the reduced sensitivity of it with less case finding.
Okay. And then the comment is just Happy New Year's to all you folks at the health unit and all the best in 2022.
Well, thank you. And likewise.
Thank you.
Chris Simon from the Barrie Advance, do you have a question?
Always. Hi, Dr. Gardner, and Happy New Year to you. The announcement from the province yesterday, you interpret it as a concession that they are throwing in the towel on trying to get this under control and recognizing that this is a healthcare system that is not equipped to handle a pandemic of this size.
Well, I think it is acknowledging the reality that we cannot manage this with a containment approach of following up every case and their context in detail, or to be able to test everybody, that the extreme exponential growth that we've seen has exceeded all resources that would be needed to be able to do it in that way. And so they're moving to actually what was more in keeping with the kinds of content in pandemic influenza plans from 15 years ago, in which we foresaw getting to the point where you wouldn't be able to do this kind of detailed work and you'd have to go with a general approach to the population, general public health measures, general messaging for people to isolate when they become potential cases. And concentrating on protecting the most vulnerable, such as the congregate setting. So to me, I think they've shifted to the kind of approach that we thought, when we were doing that planning those years ago, would be necessary given what we face.
Okay, and I'm going to wedge 2 questions into this one. One, I'm hoping you can talk about reinfection rates and whether Omicron is something that applies there. And also, 2, I haven't heard an awful lot about symptom changes and whether or not that's occurred with Omicron. Can you just touch on that, what people should maybe be looking for if they think that they might have Omicron?
So with regards to reinfection, there is data from other countries that's looked at reinfection rates and found that it can be elevated or 2 or 3-fold. Maybe in South Africa, they had something like 5% of cases were reinfected. Or to me, it actually had to be much higher because they'd already had a background rate of a prior infection that was much higher than here. So clearly, past infection doesn't provide sufficient protection, just like 2-dose vaccination doesn't provide sufficient protection against transmission. And people need to be aware of that. If they've been a case before, they could become a case again. It may attenuate or reduce the severity of it, but it won't necessarily protect you. Could you, sorry, just repeat your second question again?
Yeah, I was just hoping that maybe you could talk about symptoms of Omicron and whether or not they have changed from earlier variants.
So we're using the same battery of questions for people about their symptomatology. Some of which are like if you have one of the symptoms, shortness of breath or severe cough, or loss of taste and smell, that in itself is an indicator that you should be considered yourself a case. Whereas others that are less severe, such as gastroenteric symptoms, such as diarrhea or sniffles, nasal congestion, you would need 2 of those symptoms to be considered to be a probable case. So, they got the same array of symptomatology that we were looking for before. I noted that the communication from the province, from the chief MOH, indicated that they had a more sensitive questionnaire for students. I actually haven't seen that, so I need to have a look at that to understand that. And from my readings, I understand that this on the whole appears to be less severe. So Public Health Ontario last week put out a report looking at Ontario data comparing the severity of the Omicron cases that we've had in Ontario versus the more recent Delta cases that we've had in Ontario at the same time period, and came to the conclusion that the likelihood of hospital admission was reduced in about half on a per capita basis for the Omicron cases compared with the Delta cases. So there may be a shift towards the less extreme symptoms as well among the cases, so less likely to be short of breath, for example, or have a high fever. In other words, people should be looking for milder symptoms and not dismiss them when they assess themselves, and err on the side of considering themselves to be a case to avoid exposure to others and transmission to other people.
Thank you very much.
You're welcome.
Mark Claremont from Muskoka Today, do you have a question?
Sorry, I had trouble with the mute button. Yes, regarding contact tracing, Dr. Gardner, and the need for priority, I think you do say that that is a priority, and that due to the exceeding pressures on your staff to match that, meet that, should it not be a very high priority in regards to being proactive? Because it seems to me that if you understand where the cases were, the people who got the COVID, and where they contacted it there, that you might be able to go to those certain types of settings and figure out a way to restrict those settings from offering exposures.
Yeah, so thank you very much for that question. What I would say is that it's happening everywhere. So I don't think that finding particular places is going to be helpful. Basically, out of your home, or even in households, if you can have somebody bring it into your household if they've contracted it through their exposure in the community, it can happen almost in any environment. The safest environment is your home. If you can you take the kind of precautions that I described earlier to safeguard your household, that can help. So finding particular environments, I don't think is going to help with this. And the incubation period is shortened with this, and we're now down to 3 days on average of incubation period as opposed to 5 with Delta and longer with the previous variants. So by the time you've managed to identify a case through testing and contacted them and approach them about where they've been and who they've been in contact, the virus has already moved on, infected those people, and is continuing on to transmit in the community. So very hard to get ahead of it with case by case management. And finally, the very rapid rise in transmission that we're seeing is exceeding all resources that are at the disposal of all health units. And it would not be possible to be able to bring online enough case and contact managers to keep up with it. So we have to prioritize to focus on environments where there's a greater risk, such as the congregate settings.
Yeah, I think that does make sense. Now, today's December 31st of 2020. Looking back in the past 12 months, this pandemic has certainly changed in a lot of ups and downs. And is there anything in your mind in the past year that truly did cause you to have, quote, some kind of fear about what is going on or where this is going, maybe in the last month or two? Or was there one point in any of those 12 months that you said to yourself, damn, this is really serious?
I've felt that this has been very serious from the very beginning, very beginning. So early in 2020, the characteristics of the virus and the way it was spreading was quite apparent to me to be a very serious virus. With each wave, I've had concern. I would say in the past year, I was very concerned early in March when the province had reduced its restrictions, and we were seeing the beginning of the Alpha wave as a new variant, where Simcoe Muskoka had been particularly hard hit with the Alpha wave, and we were the first in the province to have experienced that. I was concerned that the rest of the province was about to go through that. And indeed, that did come to pass with the third wave. And when I first heard about the characteristics of the Omicron variant and its very high transmissibility, I was and am very concerned about the potential for it to overwhelm our capacity to respond to it, and therefore the need for people to take it very seriously and to reduce their contacts and put in place the multiple barriered approach that we've been speaking to all the way along.
So we will ask this question again, December 31st, 2022.
If you're asking me to predict what will happen, I cannot. I know that pandemics can go on for years. The 1918 pandemic, Spanish flu, had multiple waves and went on for 2 years. We've now been at this for close to 2 years. We now face a wave that's very big and affecting a lot of people, very transmissible. What will follow it, I do not know. This virus does have the ability to produce new variants. We shall see if that happens. I fully expect that it will become what we say endemic, which means it will continue to exist. Eventually, at some point, it will have to become something that's more in the background and periodically occurs, but at a much lower level than what we're experiencing through the pandemic. That is the outcome with pandemics, generally speaking, is they become a sort of background and endemic viral pathogen like seasonal influenza.
Great, thank you very much, and good luck to you in 22 there.
Well, thank you, and you too.
Dr. Gardner, I just wanted to check in with you about the time. We still have the opportunity to connect with the phone line if that works for you.
I'm okay.
Okay, great. Are there any questions from the phone this afternoon? Okay, and was there anyone who didn't have the opportunity to ask a question this afternoon? Okay. Well, I believe that brings us to the end of our media briefing. Dr. Gardner, thank you so much for your time this afternoon, and certainly thanks to the members of the media who participated. Our next media briefing is planned for January 5th. It's a Wednesday in 2022.
So goodbye, everybody. Happy New Year. Best wishes for the year to come. Bye-bye.
Recording stopped.
Take it easy, baby, don't you ever let it mess with your mind. Come along with me, take you to the place the sun don't shine. Well, you could use a fix, take down a button, mess up your hair. Yeah, but throw it all away. Gotta get your hands in the air. Yeah. Do what you want. Say what you gotta say. Come steal my heart. Tell me night in the day. We'll give them hell to pay. What's it gonna take for you to shake off all the things they said? No, never stop knocking, but they're never gonna let you in. So baby, throw it all away, grab your shades, put on your